everybody. Welcome back. Before we start, I just want to say that yesterday, because I was here all day, as we all were, I didn't look at my social media, and I woke up this morning knowing that this is National Gun Violence Awareness Day. And I also saw the hashtag Tulsa. For those of you who don't know, 2 doctors, their assistant, and a patient were killed yesterday by a disgruntled patient who went out and bought an AR-15 and 2 hours later killed his own doctor. Enough with the prayers, unless there's a prayer to make our president take some action. Anyway, now we're going to talk to some doctors who are doing good things in the world. And I'm really excited to be moderating this panel for several reasons, because I want to know what climate medicine is. I'm not quite sure. So we are so privileged to have our dear friend and our esteemed doctor, Dr. J. Lemery, who created this subspecialty of climate health, along with his medical fellows. And we also put him as our first doctor in the EMA Board of Directors. Dr. J and I met each other a number of years ago when he spoke at our second EMA Impact Summit, and it was love at first sight. So please welcome Dr. J and his fellows. Dr. Emily Sbiroli and Dr. Bhargavi Chekuri. Hey. Here. Am I way over here? Oh. Well, you know what, Dr. J, I'm going to let you take it away because you can talk to your colleagues, but I just really want to know, what is climate medicine? What made you do it? What made you create this? How did you get people involved? And that's enough to start with.
Well, thanks. Great to see everyone again, and day 2. Climate medicine, we're inventing it. We don't know what it is, but we do know this, that it's so important that our healthcare providers have a keen sense of all the multifaceted issues around climate change and how it impacts our health, and that it is completely unacceptable when we speak to our peers and talk about climate and health, and they're like, yeah, I never thought about that. And we're like, what? And so what we're trying to do is to create credible, knowledgeable, effective healthcare leaders that can be change agents, and they can go in any direction, whether it's working for a hospital system or in academia, with their clinics, working with legislators and policymakers, but to be able to have an informed health perspective on the policy changes we so desperately need.
Do you guys actually talk to your patients about climate change? And how do you navigate, because it's become a political football now, so how do you navigate that and just talk clearly about the impact of climate change?
Yeah, so I'm a family physician. I take care of kids in a clinic setting, adults, women, older people, and I have the liberty of having a relationship with my patients, and so I often see them back for follow-ups, routine vaccines, management of, chronic conditions, diabetes, that kind of thing. And I talk to patients about how environmental risk factors are impacting their health and how climate change sort of drives some of those environmental risk factors on a pretty regular basis. How many people have allergies? Probably a lot of people. That's a climate-sensitive disease that I kind of think that it's really important for all doctors to really know about all of the things that are impacting our patients' health and our community's health. And if you can't tell people about what their environmental risk factors are, then you can't manage them. And so for me, being a climate doctor in the exam room, that's what it's really about. It's about being informed about how the environment is impacting why they came in to see me that day.
Emily, it looks like you want to say something too.
Oh, sure. No, I was just agreeing with my colleague here. I'm an emergency medicine physician, so I just work in the emergency department, so my patient interactions are a little bit different than my colleague here. Usually it's somebody coming in with a broken bone or a heart attack or something like that. So for me, when I try to introduce this topic to them, it's usually within the context of their visit, why they're there that day. Is there a heat wave going on? Are they having heat-related illness? Are they feeling sick because of that? Do they have asthma, and is it worse because the air quality is so poor that particular day or that night? So for me, it's a little bit different. I kind of only also have a limited amount of time with the patients typically. So you kind of have to make that little pitch quickly when you're there. I do also want to say about just climate medicine in general. Medicine as a field, as we know, is just kind of very diverse. There's a lot of different specialties. You have cardiology, you have, nephrology, neurology, right? Any doctor can be a climate doctor. This is a kind of widespread, education that we're trying to provide here. So any specialty can participate in this type of education because, as we know, climate is everywhere, thus it's affecting every aspect of the body. It affects pregnancy, it affects our heart, lungs, our nervous system. Every single specialty is involved. And so my actual interest is just educating health providers on that in general. A lot of health providers don't know how climate is actually impacting their own specialty and how they can actually talk to their patients even better than I can from the emergency department. So it's a very new wave, as we were discussing earlier. It's just a new way of thinking about climate change through the health lens, but it's really everyone needs to be all hands on deck.
Yeah, and just to focus on that, like the all hands on deck, it really is important that we have all different medical disciplines. And so next year, we're bringing on a neurologist and a neurosurgeon who's taking a year off from practice to work with us. And I said, well, why are you doing this? And she's like, dude, it's all about plant-based diets and cardiovascular risk.
Yeah.
And we have got to move this forward. And then a year later, we're talking to an ophthalmologist who's like, I have to learn more about this. So it's very exciting because you create it and then people start to be attracted to it.
I know I'm going a little off script because I've got so many questions.
Go for it.
What is the actual training that you've participated in already? What did you come up with, Dr. J, or what did you
I'll
experience?
hand it off to you guys. Yeah.
You guys.
Yeah, so all of us have completed our medical training, so we're practicing physicians, and we spend about half of the time continuing our work, seeing patients in our clinical practice all over the country, and then the other half of the time, it's a little bit of everything. We meet regularly and kind of meet with other climate experts to learn about what climate science is, learn about all the different health impacts. We also work with federal partners, so we're all sort of placed in a federal agency where we then get to learn about how federal policy is really implemented and what they can do with existing kind of work streams to work at climate, health, equity, and that nexus. And so I work at the U.S. Global Change Research Program, and so I'm helping with the human health chapter of something called the National Climate Assessment, which is sort of, it's like this big federal scientific assessment on what are the health impacts of climate change in this country.
Yeah, I would.
Wow.
Big.
Okay. So is there a curriculum? But then I'm starting to think, oh my God, if you're working with the federal government, then does this like bounce back on them and they kind of go, oh wow, climate change is real and we need to do something about this?
I work with the U.S. EPA. I mean, I'm not, none of us are actual federal employees in any way. We're just kind of like students of them in a way and consultants in a way. At least for my branch that I worked with and the folks that I interact with, I mean, climate change is very much on the agenda, super aware of it. Had an opportunity to work with some reports and some data that was very scary, just in terms of what the projections really are. And so, yes, it's definitely on the agenda. I think it's just, there's so much, bureaucracy and polarization right now that to get just anything done is challenging. But I mean, my personal experience has been there are many people with the right idea, many people with their kind of hearts in the right places on this issue. It's just, there's other things in the way.
The government recently has been reinvigorated, right, with the new administration to have climate and health embedded in many of these agencies. And so there is sort of a real excitement when we say, hey, we have a physician who you don't have to pay for, who can embed with you and really give you a clinical perspective. Now, what Bar's talking about the National Climate Assessment being very modest, that is the United States government's guiding assessment, quadrennial, I think, of climate change across 13 of the federal agencies. So it's the entirety of government.
It's the IPCC of U.S., the IPCC report of the U.S. IPCC is the United Nations Intergovernmental Panel on Climate Change, kind of their huge report that they do every 7 years. It's like the global assessment of how screwed we are, basically. I recommend everybody looking at, and just to go into our curriculum, so it starts with that, right? So as physicians, medical school, none of this is in medical school curriculum. We don't know anything about environmental effects, none of it, right? We spend 8 years of our lives, learning and selling our souls to the study of medicine. And then you get out and you're like, what about this huge pollution problem? What about the changes in weather frequency? What about all these vulnerable populations and the kind of equity problems of climate change? We have no idea. It's not taught to us.
Are you still learning or not learning about nutrition too? When I found that doctors don't even get taught how to teach their patients to eat well.
Yeah. So I'm a primary care doctor. My job is to talk to people about eating their vegetables and fruits. And no, I mean, the pollution thing, I'll just say, not even 5 minutes really in medical education about air pollution. And it is like the number 4 killer, right, globally.
Yeah.
And then cholesterol, which we get like endless hours of lectures about, is like number 7 or 8 on that list. So there's really not a fair distribution of airtime in medical education on what's really impacting people's health, and it's really centered around the environment. So it's your clean air, your clean water, all of the things that we've been talking about at this summit. Similarly, nutrition is a very big deal, and this is something that I feel really strongly about because sometimes climate change is often framed as you need to fix it as an individual. And the thing about nutrition is it actually is something that can be really, really empowering because as a primary care doctor, eating your fruits and vegetables is really good for you on a regular basis and has immediate impacts and benefits from a health perspective, and also is one of the most powerful things that we can do at a systems level and participate in to really make a huge dent on climate action.
Yeah.
Eat your fruits and vegetables, Jay.
But it's not covered in medical education.
Yet, there is a huge up and coming wave of Gen Z folk who, I bow down to all of you at this point, that they're making a huge movement in medical schools. There's massive coalitions of medical students who grew up, knowing about this more than we did and are very concerned. And there's huge petitions to get it included in medical education now.
That's fantastic.
Yeah, it's hope. It's
hopeful.
That's where our optimism is when we talk about optimism.
Well, that's actually one of the questions that I think was on the list. Like, what makes you feel hopeful?
So that is one. I want to share just, I think what we do is as climate docs is we're actually seeing the effects on people's health. So when, we're all here together, we're talking about air pollution, we're talking about changes in our environment and our ecosystems, our food change. I see patients coming into the emergency room with those actual problems. So I'll just share a case that I had just a few weeks ago here. I practice in San Diego. I practice in Southern California. And I had this young guy come in. He was 36 years old, otherwise healthy, but all he had is asthma. And I'm sure a bunch of you in this audience have asthma too. It's the most common respiratory disorder just globally. He comes in, he says, doc, I've been using, my inhalers for the last 9 hours. I've been feeling sick since last night, and I can't seem to get my asthma under control. And this guy's like heaving, he's coming in, he's like, I can't breathe that well. I don't know what's going on. And so I'm like, okay, it's an asthma attack. I've seen these before. I give him my usual asthma stuff, give him the nebulizer treatment, give him some steroids, check on him a little bit later. He's not getting any better. Give him more nebulizer treatments. Then I have to put him on a respirator, like the ones that help you breathe with positive ventilation, try to help him make it through this attack that he's having. Still wasn't working. He was actually getting worse. Then he got so bad that I had to give him a shot of epinephrine, which is what we give to people with horrible allergy reactions to anaphylaxis. This is like a life-threatening, illness, right? So I had to give him that. And then I gave him like a medicine called terbutaline that I haven't used in years. It's like a fourth-line agent that nobody really uses, really just for severe cases. Finally, after hours, he started to be able to breathe better. He went to the ICU. And so I was talking to him, I'm like, what triggered this asthma attack for you? What were you doing? Did you exercise? Did you try something, new food? Do you smoke? Were you around construction? He's like, no, I was just sitting at home. I work from home. I took my dog for a walk, like I always do. Like nothing new at all. I was like, did you change your medicines recently? Or they just literally I asked him like thousands of questions, couldn't identify anything. And I'm like, why was this guy so sick? I go home. I'm like plagued by this, right? I'm thinking like, why couldn't I figure this out? This is the sickest asthmatic I've seen in a long time. And he didn't have COVID, because that also was another factor, right? Do you have COVID? Because the COVID messes all this up. He didn't. And I'm like, what is it? I look, because of our training and because of the way we're thinking about it, I was like, I'm really curious. He lived in Temecula, which is kind of, near down here. And I looked at the air quality. And the night that he got sick, the air quality was horrible. It was double of what it was that night, when I got home that night. And I was like, and it was literally a spike of horrible air quality in his neighborhood. I had his zip code, so I put it in there, and it was a spike of this terrible air quality that night. And I was like, I'm not a scientist, but hello.
Oh, you were.
You did
Right.
the research. You're a detective.
Right. And so like now I'm thinking like, okay, imagine imagine another patient like that and another patient, right? One after the other. Like our emergency room, our team was just really focused on the sick guy, but imagine if there was like 5 other people, right, affected by this. And he was otherwise a healthy guy.
And do you know what caused that spike?
I don't know what caused that spike. I didn't look too deep into it, but there was a mixture of really high level ground level ozone seemingly in the air in his neighborhood that night. I don't know where it came from.
Usually it's heat makes the ozone much worse. And so if it's
Yeah.
a hot day, we see more admissions, we see more people coming in. And
Yeah.
So are you predicting that you were going to see more and more of this because, as we
Yes.
know,
Yeah.
the Earth is getting warmer,
Yes.
and nobody's really doing anything about that, unfortunately. Don't mean to be a downer, but
Yeah.
yeah.
And it's going to affect folks who, right now it's a problem for very sensitive groups mostly. Like they tend to be most affected. So people with other medical conditions, older folks, the very, very young, immunocompromised. But once you get to certain levels of pollution and levels of air pollution, everyone is affected, And so these are the things that I see, right? This is why this is important to me and why I need to bring this kind of information to the bedside and just share, what's going on, and how it's getting worse.
Yeah, we know wildfires increasing in intensity, duration, and immediate damage from the fire, but huge swaths of a continent socked in with poor air quality and particulate matter. Even in Denver, we get from the Mountain West, it just sits there. And, it's the old people on oxygen that get dinged, but it's also the young, healthy triathletes who are like, I've never, coughed like this in my life. Right. So that, and to your point also about increased heat, heat degrades air quality from different chemical reactions in the atmosphere. So.
Can I just, for a moment, share with you guys? I live in West Hollywood, right? And I got to go out every day and wipe down all the surfaces because there's dust and dirt. Like, where does this come from? And I realize I'm breathing that.
Yeah.
We're all breathing these little particles. They're not even little. I can see them on
Yeah.
my hands. Every morning, there's more stuff there. Like, what hope do we have?
so what makes up air pollution is actually that dust that you see is not as bad for you, but usually it comes with dust that's way smaller and that you cannot see.
Right.
And that's the stuff that we inhale and goes deep into our lungs and causes, everyday things like heart attacks, strokes. It makes, pregnancy outcomes worse. It can cause, depression and cognitive issues. So it's stuff that we're already managing. And what I would say is that most physicians right now have an incomplete view of what's causing those presentations.
Right.
So we know that things like poverty and, racial injustice and these things can make those outcomes worse, but the environmental piece of it is not really taught at the moment. And what we're trying to do is really help change that. Like, don't you all want your doctors to know how the environment is impacting your health?
Right. Like for the patient I had to call him later and say, hey, I think I figured it out. I think you're very sensitive to your air quality. And like, here's how you can look up your air quality. So maybe next time don't walk your dog outside when the air quality is this level. And in fact, it's funny you mentioned air quality from yesterday, because I was curious and I looked it up while we were at the little cocktail reception, and the air quality right here at this hotel was 93, was almost in the moderate to severe range. Once you hit to 100 in terms of your air quality index, it's bad for most groups. But we were at 93 last night. Yeah, just outside hanging out together. So it's just, and it varies throughout the day, but it's so pervasive at this point that it's really no longer an issue of, a far off country with a smog problem. It's not a problem in Antarctica. It's literally affecting our health, so.
Yeah, and I, Ed Begley is always telling us, Mr. Environment, he's on our board also, but, the air quality today is better than it was 40 years ago, and it's still bad. Is that what we're saying?
And it was a Republican president that passed it, interestingly. Clean Air Act, 1972, Nixon.
When they had some morals. Oh,
Yeah.
I'm sorry, I didn't.
Yeah, well, I think the air quality story is actually, in many ways for me, when I learned about the history of it and learning about how it was really scientists and doctors and other health professionals and public health, groups that were able to put this link together, educate the public, educate Congress, and all of these decision makers and stakeholders, and that's why those laws were passed, is because physicians as well as other health professionals and public health professionals are trusted voices, and when you can really rally these groups together and communicate this message in a way that is meaningful to people, that's a great way to get sweeping public health legislation and policy implemented that has such an amazing impact. Because while air quality stands to get worse with climate change, it has dramatically improved in this country because of that kind of action. So, we stand on the shoulders of giants, but I think there's another wave that we kind of have to step up for.
Sure, go ahead.
We had lots of questions leading into this, and we told everyone, save your question. Half of them were from Alex, but the other half we said save them for the panel. So we're about halfway through. Do you want to open it up a little early for Q&A?
Yeah, absolutely. Who has a question?
Got some hands over there.
Right over here.
Hi. So I work for one of the studios, and so a lot of what we're talking about now is how we communicate this to our audiences. And I met with a nonprofit recently who's working on this and understanding how behavioral change can come from our media. And so one of the really interesting facts that they said was, other than doctors, one of the most trusted sources of information are local weathermen.
Yeah.
And so I'm wondering if there's kind of an opportunity to, so they basically, what this foundation is doing is sending informational packets to these local weathermen to connect these natural disasters to climate change, because they're not allowed to say it unless they actually can prove it. And so I'm wondering if you can also tie these, air quality and natural disasters and et cetera to the health of these local communities, and if you've kind of had those conversations.
Absolutely, yeah. I think that introducing health in this whole space is kind of the great equalizer of everybody. It tends to get everyone's attention, regardless of your political persuasion or wherever you are. on that. I think that health is kind of the bridge, and it's the way that we can best communicate to communities in general. I think that is probably a better way. Like, no offense to the weather people, but like, I think it just is. I think people want to know, like, look, this is my chest hurts when I go outside. Why is that, right? As opposed to, can I have my barbecue, on Wednesday versus Friday? It's outside. It's a little bit different. So I think that, yes, I think health is absolutely the vehicle for that.
And to that point, smoking became cool for a number of reasons, and it became cooler because of how it was portrayed in the media. And at some point it stopped being as cool, especially in the United States. So the rates of smoking are going down in this country and have been for a while. And that's, in some part, I think contributed to how it's portrayed in scripts and films and the media in general. And so it would be super cool, I think, if we could do the same thing for behaviors that are healthy for people to start with, right? Like, there's a lot of co-benefits. If you are exercising, eating right, avoiding certain things, that's good for you anyway. If you're eating lots of vegetables, like, that's really good for you and also really good for the planet. And if we can sort of normalize some of this behavior that's healthy and really put health at the forefront of how it's portrayed and that kind of thing, then I think it sort of helps shift culture. Because we're already seeing, like, plant-rich foods are so much more popular and cool now, and mocktails are cool. Like, there's all these things that's all trickling down, so we're starting to see it. But
It's so interesting that, did you want to
I
say
just want to add
something?
one thing. There's a
Okay.
group called Climate Central that works with broadcast meteorologists, and we work very closely with them on messaging, and they're allies. So I just want to point that out.
I just had a random thought, but, because we're talking about the entertainment industry also. It's like whenever I watch movies, I never see anybody sit down to eat or charge their cell phone. Like, what is that? We all have to do that, or go to the bathroom for that matter. It's like, make that be part of it. And, like, let's go eat something healthy in this scene with
Yeah.
so-and-so, Anyway, boo. Who's got another question? Okay.
So it's obviously tough to create a full protective barrier outside, but I'm curious to hear your thoughts on air purification indoors, how that could potentially mitigate long-term, respiratory illnesses, asthma, emphysema, all those things, and what specific types of technology you would endorse, HEPA, PCO, UV, HVAC infrastructure overhauls. How do you do that if you are the individual with your home?
yeah, so I actually talk to this with my patients all the time, sometimes at their annual visits and that kind of thing. If I can tell from their medical history that they might be sensitive to poor air quality. And I'll just say, from a global health perspective, indoor air quality is a huge problem globally, because in other parts of the world, people are still using stoves and that sort of thing in their indoor homes that really, cause a lot of damage, specifically for women and children. Here in the U.S., regardless of whether you live in an apartment or a home, you should have your HVAC or furnace system switched out every 6 months. And then a HEPA filter is what the EPA recommends. Yeah. Some people live in zip codes or buildings where they may have higher worse indoor air quality. And for those people, you can purchase an air purifier. And again, we recommend a HEPA filter. But air purifiers can be cost prohibitive to much of the population at present. In addition, they run on electricity, which is another cost, barrier for a lot of patients that don't have sometimes even health insurance, right? So there's Energy Star ratings as well, and so you want to pick one that's really energy efficient if that's an issue. And if you really can't, let's say you can afford to buy an air purifier with a HEPA filter, but you can't afford to run it all the time, you can try and run it strategically. So perhaps on those really bad air quality days, perhaps when you're running a lot of appliances in your home, when the indoor air quality can spike and that sort of thing. So, these are conversations that really need to happen both in the exam room, but also at a broader level, because, sometimes I might write a letter of medical necessity because they're not covered by insurance at the moment, right? And it's a Band-Aid, it's not the fix. It's not a cure or a way to prevent the problem, but there are people, particularly if you're older, you're living in a nursing home or subsidized housing, that sort of thing, where you can be really, really vulnerable. I would recommend not purchasing the air purifiers that create more ozone, because those also do exist.
What are they, so we can avoid them? Do you know their names?
I think I don't know their names, but I would say my recommendation is look for HEPA, HEPA filters. Those are the ones that work really well and that have some health benefits. And I mean, sometimes like the fancier, newest thing isn't always the best thing.
What in the world would make a manufacturer create an air filter that makes ozone?
Ozone is used sometimes in disinfecting. So I think that's why it's sometimes utilized in certain products to do disinfecting processes. So I think that's where it comes from. And I think just manufacturers sometimes will just use it as like, hey, it's an extra disinfecting and we can give you
But
some
it's
ozone.
bad for us.
Right. Yeah. I just want to also highlight that your question is the perfect example of something you can ask your doctor, which I think a lot of patients aren't empowered to do. You don't think about who do I ask, right? If I'm worried about my exposure to poor air quality, who do I ask? And to me, it feels obvious. Well, ask your healthcare provider about it, right? If it's something going into your body, you should ask them. So that's a perfect question for them. On the flip side, what we're trying to do is make sure that healthcare providers are educated to be able to answer your question. And as of right now, it's a bit far and few in between. Most doctors could probably direct you to certain resources, but to really stratify your risk, understand you individually, what asthma medications are you on, what's your family history, what's your zip code, to really understand what you would need in your personal environment. So that's a great example of a question that starts to need to be transitioned into the actual exam room, like Bar was saying. Yeah.
We have another question over here.
Yeah.
Hi. Y'all had mentioned how in medical school education there is a gap for climate-aware education. So I'm curious on your thoughts on how that could be implemented within med school education and how one would overcome the fact that I think med school education could either result in an MD or DO, and those are two different accreditation bodies. So what would that process look like? And in the meantime, are there any resources that we as an audience can tap into in regards to identifying climate doctors in our areas? Because I would love to have a physician that, is climate aware and is thinking the same way as you guys.
So cool. I love that question. Do you want to try it?
Yeah, I would say in terms of, so I have a real interest in medical education in particular, and I would say the first fellow, actually, she runs a program at Columbia where they're really working to integrate climate change and health education across the board, all health professional schools, nursing, medical schools, et cetera, et cetera. And we're working on it at our program as well. So it's a little bit of a slow process. Medical culture it moves slow. But what gives me hope is actually whenever I talk to medical students or younger residents and that sort of thing, they totally get it. They're trying to figure out how they have a big interest in having this as part of their education, and actually their interest is what's helping really move the needle much faster. And we're developing this curricula. We're working with the accreditation bodies to try and get this, covered, really expand the model of current, thinking about what makes up someone's health and well-being. It's when we're talking about social determinants, the environment is a big driver. And the really interesting thing about this moment in medical education is there's been a huge investment in health equity, both in terms of time and resources just in the past 3 years because of everything that this country's been going through. And the way that I sell it to people is environmental justice and climate justice is a vehicle for health equity, right? You can't get to health equity if you don't address environmental injustice. And so, that's...
I'll just say also, you just got to fight for it, right? No one's making space. So we just stood up a program and invited students to join in their 4th year, which is kind of their last year. And then you're working in the trenches and getting students motivated, and then you're meeting with the deans, and then we're working at the highest levels at the National Academy of Medicine to convince medical educators to make room and do it. We were successful because we had our dean to pay for it, and he finally said, and as far as we know, it's the only med school in the country that's paying for a climate health program at a medical school. But it's like everything else in life. You just have to do good work and make sure your product is solid, and then be provocateurs and use every leverage you can to just be like, come on guys, you need to help us. You have to pay for this, and you need a little bit of moxie and cantankerousness, right? Because otherwise it's just nothing happens. Inertia is the grand enemy of something as staid and as as long as medical education. It's been around 150 years, right? Nothing changes fast, as you guys said.
Yeah. To specifically answer your question, though, there is no credential right now that you could look up. Like if you look in your in-network, looking up a primary care doctor that says, this is, okay, I want to see this doctor. How do I know if they're climate aware, if they have this education background? There's nothing after the MD that will tell you if they are, except until he's going to launch this new diploma program, and their program is going to, take off. And so there will be something eventually that does have that. But as of right now, there isn't. And in terms of resources, there's Medical Students for a Sustainable Future is the basically huge, national cohort group of medical students that are really pushing this movement forward and pushing the education component forward. So all of those, future doctors are going to be climate aware. So remember some of their names, and a lot of them are active on Twitter and all that. But but yeah, as of right now, it's not easy to find.
Could we create kind of like an EMA green seal for doctors who are climate?
Interesting you brought that up, Francis. We're talking about having the Climate Medicine Awards as a way to kind of bring and honor people to come at the EMA Awards. Still work in progress, but that would be a wonderful way to kind of lightning rod to bring people together, right?
Yeah.
So.
I would just encourage you all to ask your doctors about how climate change is affecting your health,
Yeah.
whether they're experts or not.
Shock them.
Just educate them a little bit, ask them. Yeah.
Get them thinking about it for real. Because if the patients start asking,
Yes.
then they're going to say, oh, God, I got to know about this.
Exactly.
Yeah.
Yeah.
We have a question here.
Do you know of any other diseases that have increased over the last decades due to climate change? Like one thing that I learned was like Lyme disease, because tick populations in the East Coast have increased, and they're now like even more active in the winter, which that wasn't common back then. So just curious on that.
Yeah.
Oh my God.
Great question.
Like, what diseases aren't? I mean,
Yeah.
I can't even think at this point. Interesting. Those are what they call vector-borne diseases. So diseases that are, transmitted by mosquitoes, parasites, things like Lyme disease. Yes, they are seeing changes in those diseases. What's interesting, what we kind of learned about is that there sometimes is an uptick in some places and a bit of a downtick in other places because the climate is becoming so variable. So habitats that were once uninhabitable for these bugs is becoming habitable, and then vice versa, where they used to live, they're no longer able to live. So it's kind of migrating around. So we're starting to see diseases migrate around a bit in terms of the vector-borne stuff. Other diseases, Bar was mentioning, there's a great institute, it's called the Global Burden of Disease, like Global Institute for Burden of Disease, something like that. And they look at exactly that question of how many deaths in each of these disease categories is attributable to things like air pollution. And what they're finding is that those numbers are just wild. I mean, it was something like 20% of newborn baby deaths is due to air pollution alone. Just 20%, 1 in 5 newborn deaths is due to air pollution alone globally, right? So they're finding out these connections, and it's just this huge explosion of making these attributions, basically. Yeah, so they're finding that no body system is really unaffected by it because of what Bar was mentioning, how small some of these particulates are, these microscopic particulates that we're breathing in. the smaller they are, the deeper they can get into your body. The smaller the cells they can reach, the smaller the blood vessels they can get through, and they can really start affecting every system. So we start seeing things, I mean, there's, some of them are even, some studies are suggesting connections with autism, with the increase in autism diagnoses in children could be attributed to air pollution.
And the plastics in the water.
Yeah.
It's
right.
heads, shoulders, knees, and toes. It's really every disease that we manage on a regular basis in the right context can be climate sensitive. So a broken bone, if it's happening in the setting of, increasing frequency of disasters, and we're seeing more of it, that's a climate sensitive issue. And I think that's actually the interesting thing about this is when we're talking to other physicians and educating other physicians, what we're really saying is, this is stuff that you're already managing on a regular basis,
Right.
and it's infectious disease, it's trauma, it's cardiovascular health, it's prenatal care, and then, pediatricians have really done a great job because they're probably the strongest advocates in the climate and health space, just because babies born today literally have to take more breaths than the rest of us of polluted air.
Take more.
More breaths of air. They're going to breathe more.
Lifetime.
Yeah,
You
like
know,
a lifetime
over time,
exposure.
they're going to have more hot days, exposure and that sort of thing. And so it really kind of, when we think about health equity, one of the things that we're really trying to introduce is this idea of intergenerational inequity, and that it's not fair, for children in terms of their health outcomes, that they're going to be experiencing more.
And I'll also just share with you too that due to air pollution alone, per year in the United States, we experience 2/3 of a pandemic's worth of deaths just to air pollution alone in the United States. So it's just a crazy number to think about how many folks are dying each year from these issues. I think there's more questions over here. Oh yeah.
My question, as someone who's directly impacted by air pollution, I really wanted to kind of know the messaging and the storytelling that goes behind really kind of advocating around how are ways to better communicate the science and data around air pollution. Because I think there's the bottom line of like, it comes from cars, factories, the fossil fuels, right? And I think that's one bottom line, but I think how can we have doctors and those that are storytellers on the ground of not just educating the doctors around this issue, but making sure that like the people who are working around this issue, advocating around, getting legislation passed, and the real storytellers that who are affected by air pollution, how can we make sure that they get the science so that they're able to better communicate that? What are your thoughts on that? Sorry.
Yeah, when I talk to patients, I often, they're there because they're sick or they have a health concern. And so often I'm able to connect with them kind of rooted in that, saying, okay, well, you came in here because you were worried about this. And there are many things that can cause this outcome. One of them happens to also be, the environment, whether it's water security, air pollution, whatever it might be. And so that's something that impacts you directly or your family directly. And if you want to come in to see me less, into the doctor's office, then that's a variable that has to change. And I think, as Jay mentioned yesterday, that doctor-patient relationship is pretty special and sacred. And so you're trying to talk to them just one-on-one. And I find that when if we're testifying at a state legislative hearing or that kind of thing, it's sort of what Emily shared is we can share some of those stories, and they put a human face to this, and it really changes the picture of what you think climate change is about.
Also I would add that I personally don't really know how to share those stories to answer your question, and that's where this becomes a very interdisciplinary multi-industrial problem, that we all have to work together to really do. You guys are probably way better storytellers than I'll ever be, right? So I don't personally know how to do, it's just, we have to work together to really be able to get the message out.
I had a colleague who, she didn't really care much about climate change or the environment, and a lot of the climate and health stuff that I would talk about didn't really resonate with her. Interestingly though, air pollution and heat, as it pertained to her pets and the horses that she owned, was a major, motivating factor, and that really resonated with her. And that was something that, maybe made her think about the climate and the environment in a different way. So I think, you have to find what connects with people. And
We've got time for
One more in the
question.
front. Yeah. There.
Hi.
Sorry.
First of all, thanks so much for coming because, like everything else that I look to Emma for, this is something I never had one thought about, honestly. I mean, maybe a little bit, but not very much. And so now I'm just on fire about all of this. And I was particularly interested in the applications from a mental health perspective, because I have found just personally and in my sort of circle that all the things that we've been exposed to and had to go through collectively and individually over the past several years has led to, both in myself and in my circle, just sort of a low-level depression and a higher level anxiety about life in sort of an existential way. Like I now have existential fear about life, which I never have had in my life before. So in listening to you today, I think to myself, holy shit, not just another thing that's going to raise my anxiety level, and what can I do about it? But I wonder, how do you communicate to constituencies that are, first of all, maybe they don't go to the doctor a lot, or maybe they are kind of resistant to taking steps to change their lives or their lifestyles. And how do you present the information to people while not triggering even more anxiety in a climate, if you will, of heightened anxiety already about other things that have happened?
Yeah, I would say that one thing that gives me a lot of optimism and hope, and I think it's something that we keep touching on, and it's what, Emma, what we've seen on this stage as well, there's just so many opportunities and solutions that already exist. So the good thing about health is that once we know the cause of something, we can treat it. Once I can identify where the problem is, we can typically treat it, and we can do a good job doing that. And we can also do a good job in educating on prevention. So the way over this from an individual perspective is absolutely not insurmountable. It's just you need to be connected with the person that can get you the information that you need and the help that you need, because there is everything is already pretty much out there. It becomes a little bit more murky and complicated on this global level. But I find that, if you just kind of focus on the individual, focus on their main problem that they're presenting to you that day, taking it baby steps, there's always a way around it. There's always a way to kind of deal with it. And, me just, as an ER doctor, yes, I'm going to see a lot more asthma. Yes, I'm going to see a lot more heart attacks. Yes, I'm going to see a lot more strokes as they come on. But I have a lot of faith in my ability to treat these patients, my colleagues' ability to treat these patients, that we have what we need to really tackle this. It's just a matter of doing it on scale, So I would say that. I would say that just getting, communicating your concerns always, and then seeing where the helping hand comes from, and it's usually there. Yeah.
Yeah, for me, I get a lot of hope in just like looking at what's happened with this pandemic, and look at what happens when we mobilize resources and recognize what the problem is, mobilize resources, and you have a vaccine in about a year that saved as many lives as many have been lost, right?
Even more, way more.
Within a day, like one day, telehealth went live across the country here, right? Which has, that is transformative for the healthcare industry. Single women across the country who normally cannot get to their doctor or get their kids to their doctors because they're too busy with 2 jobs and that sort of thing, now can access mental health services. They can access medical care. They can just get a full suite of services, and that happened in the middle of a disaster, right? So there are solutions, there are lessons that we have learned in the past couple of years, and there are silver linings. So it can be overwhelming, but I think there's a myth that this is this like untreatable problem. There are simple solutions that already exist that can be deployed at scale already, and it just takes recognition of the problem and leadership.
Yeah.
And in the moment, if you have anxiety, just take a deep breath in, hold for 3, and a deep breath releasing. Do that a few times just to ground yourself again until you can get to the doctor. Jay, do you want to wrap up?
That was great. You guys give me hope, and I just wanted to thank Emma and the Climate and Health Foundation for supporting
Yes, thank you.
your work and our work, and congratulations.